identifies self by name, identifies the resident by name, washes hands, explains the procedure to the resident, speaking clearly, slowly, and directly, maintains face-to-face contact whenever possible, provides privacy, adjusts the bed to a safe level, locks the bed wheels, put on gloves, turns resident on the side or turns the head to the side and places a towel under the cheek and chin, places an emesis basin next to the cheek and chin, dips swab in cleaning solution, squeezes out excess solution, wipes the teeth, gums, tongue, and inside surfaces of the mouth, changing swabs frequently, repeats until the mouth is clean. Rinses with clean swab dipped in water, squeezes out excess water first. Removes the towel and basin, pats lips or face dry if needed, applies lip moisturizer. Empties, rinses, and dries the basin, places basin in designated area or returns to storage, places soiled clothing and linens in proper containers, removes and discards gloves, washes hands, returns bed to the lowest position, places call light within the resident's reach, washes hands, documents procedure.